The crown and the root. Each tooth has a crown and root. So as you can see, we have the crown and we have your root. The crown is covered by the hardest mineralized tissue in the human body, which is the enamel, while the root portion is covered by your cementum. Junction between your crown or enamel root with cementum is called Cementoenamel Junction. Again, cementum, enamel. The junction between the two is called the Cementoenamel Junction, or just simply the CEJ, also known as your cervical line. For your crown, we have this so-called the anatomical crown, which is best described the portion of the crown above the CEJ. So this is the CEJ. So anything that is above your CEJ is your anatomical crown. While if there is the presence of your gingiva, this is what do we call the clinical crown. A clinical crown is the portion above the gingival margin. The portion above the gingival margin is called the clinical crown. So let's check. There is a quite discrepancy or difference between the two, because when we remove the gingiva, there is this part that is not covered by the gingiva, but it's still part of the crown. So to avoid the confusion, we divided into anatomical crown and your clinical crown. Same as goes to your root. You have your anatomical root. So it is best described as your root portion below the CEJ, and the clinical root is the portion below the gingival margin. Moving forward to the tissues of the tooth, we have your crown and the root. The outermost layer of the crown is called the enamel. Under it is your dentine, which forms the bulk of the tooth. The dentine runs from the crown down to your root, while the covering structure of your root is called the cementum. The pulp is the tissue responsible for the sensation or sensory purposes or function of your tooth. Supporting your tooth is the periodontal ligament, which attaches your tooth to the bone. You have two types of teeth, which can be divided into anterior teeth and posterior teeth. So the anterior teeth is the teeth that can be seen when a person smiles. So I have to make a midline. I'm sorry if it's not perfect, but these are called your central incisors, the lateral incisors, and the canine. Since this is found in the upper arch, we called it the maxillary teeth. While for the lower, we call it the mandibular. So we have your maxillary central incisor, the maxillary lateral incisor, and the maxillary canine. While for your mandibular or lower arch teeth, we have your mandibular central incisor, the mandibular lateral incisor, and your mandibular canine. While for the posterior teeth, we have your first premolar, second premolar, the first molar, the second molar, and the third molar. Moving forward to the surfaces of your teeth. So the central incisor and the lateral incisor, including the canine, is in contact with your lips. With that in mind, lips, we associate it with the term labia or labia. So this surface is we call the labial surface. While for the posteriors, recalling them is your first premolar, second premolar, first molar, second molar, third molar. We call this surface in contact with your cheeks is the buccal surface. Collectively, the labial and buccal surface is called the facial or facial surface. Following those surfaces is now the surface towards your tongue or your palate. We call these surfaces as your lingual surface. So, for your premolars and molars that come into contact with other premolars and molars in the opposite jaw during act of closure is called the occlusal surface. As you can see, it is shaded with the pink color. That's your occlusal surface for your posterior. Sir, how about the anterior region? How we call it? How do we call it? We call it as your incisal surface. The surface of the teeth facing toward adjoining teeth in the same dental arch are called the proximal surface. Here are your proximals. The proximal surface may be called either mesial or distal. When we say mesial surface, we have to draw a midline between the two central incisors in the anterior region. If the surface is faced toward the midline, it is called the mesial. If the proximal surface is distant from the midline, we call it the distal. Again, from the midline, if the surface is towards the midline, we call it the mesial. If it is distant from the midline, we call it the distal.